let's talk about Medicare. So under the Medicare plan, and I've got 2 or 3 slides on this, so I'm going to talk about generals first, and then we're going to talk specifically year by year. So the first thing here is, under the Medicare plan, how you get paid is based totally upon your allowable charges that you currently charge through Medicare. So on an annual basis, you have a certain amount of charges that you're charging through Medicare, and those are your allowable charges. That's how you're qualified under this plan. So Medicare has said we will pay 75% of all your claims based on those allowable charges. We'll pay 75%, but up to a maximum. So the maximum is by year. So every year the maximum changes. So in year 1, if you had a maximum of allowable charges of $24,000, then they would pay 75%, and that 75% would get you $15,000. So that's how this works. So the great news is, if you also qualify under the plan by 2012, then you will receive a $3,000 bonus. So the incentive here, remember what I said about the government wanting people to adopt and adopt fast. They're really, really driven to get you to do this. So if you adopt fast, if you qualify under the plan, you get a bonus. For all of you who already have EMR, there should be absolutely no reason why you're not going to qualify next year. So you would be eligible for this $3,000 bonus. If you are in a health physician shortage area, you're also eligible for an extra 10%. And in order to receive the maximum payout under Medicare, you have to qualify by 2012 to get your maximum payout. Now, I'm going to share with you why you're going to be really thrilled, because in actuality, you already being on an EMR, utilizing a product, you're going to probably be eligible to apply and fall under the program next year, and it's going to be easier to apply, and that's great. So there is also incentives for other providers who are not using an EMR to do this sooner than later, but for you who already have one, you're actually in a very good stead. Under Medicare, there are no payments after 2016. So for providers who jump in later, then it actually is going to cost them. Penalties begin in 2015, and if you are not already certified using in a meaningful way, qualified under the program by the year 2015, you will see Medicare cuts. There'll be a 1% cut in 15, 2% in 16, and so on. So that's the stick part of the plan. So this is what it looks like. Again, if you recall, on the right-hand side of the slide, I discussed your Part B annual charges. If they were $24,000, then actually your 75%, including your $3,000 bonus, would be the $18,000. That's what you would get year 1. Year 2, if the maximum that the government has set is $16,000, that's their max. If you have allowable charges up to that, they will pay 75%, which is the $12,000, and so on. So for you, assuming you qualify this next year, which I can't imagine you won't, if you qualify in 11, you actually would have maximum payout, and you would receive your maximum payout. In this case, you'd have $18,000, you would go down to $12,000 in 12, $8,000 in 13, et cetera, and you would have received all of your money before 2016.